Pennsylvania for 5 minutes of questions.
Thank you for yielding, Mr. Chairman, and thank you, Chairman Wenstrup and Ranking Member Ruiz, for holding this hearing today. And thank you to our panels of witnesses for appearing on this critical topic. In the early days of the coronavirus pandemic, grievous and critical errors made by public health officials in New York, New Jersey, and in Pennsylvania, my home state, had disastrous consequences for our seniors. And it's clear now that those whose duty was to protect our most vulnerable and high-risk individuals failed and fell short of the oath to first do no harm. On March 13, 2020, CMS issued guidance for nursing homes and long-term care facilities, intending to serve as a blueprint for individual states to best prevent and control COVID-19 outbreaks in nursing homes. This was not a directive for nursing homes to unsafely accept COVID-positive patients back into the nursing home. Furthermore, CMS Administrator Seema Verma said that under, quote, no circumstances should a hospital discharge a patient to a nursing home that is not prepared to take care of those patients' needs. Yet only 3 days later, the Pennsylvania Department of Health issued guidance mandating that nursing homes accept patients even after they had tested positive for COVID-19. Must-admit nursing home orders willfully and deliberately disregarded CDC and CMS guidance. Now, Admiral Rachel Levine, then Pennsylvania Secretary of Health, moved her own mother out of a personal care home as patients with COVID-19 were being moved in, a decision that ultimately led to more infections and more deaths among our state's seniors, while shielding her own family, which was a luxury that was not afforded to many Pennsylvanians. These disastrous public health policies led to insurmountable amount of pain and grieving for families who lost loved ones. My office received calls from constituents who were refused the chance to visit dying spouses, parents, and grandparents. Yet this committee has been stonewalled by requests for more information regarding these must-admit orders. It's time to have accountability. It's time to have accountability for failures and cover-ups that led to thousands of needless deaths. Dr. Grabowski, given the guidance issued at that time in March of 2020 by CMS, was there a good rationale for the must-accept orders issued in Pennsylvania and in other states?
As I said earlier, that policy was a mistake.
I agree. It was an incredibly lethal mistake that was made. Mrs. Ayes, I understand your group has members from Pennsylvania as well.
We do.
Can you please describe the end result of these orders and the impact that they had in my home state, the Commonwealth of Pennsylvania?
Regardless of the state, it was, it devastated families, even to today, because I know that Pennsylvania families, New Jersey families, New York families, all reach out with an eerie story of how their loved ones met their last days. And those that persisted in nursing homes with the lockdown afterwards, they were treated like zoo animals. You cannot see your family except through a glass door or through some electronic device. We have devastated our families because seniors are the center core of our families. My mom didn't get to meet her grandchildren or her great-grandchildren, and we're going to continue to stand for them because they are the center of our families, and I'm sure everyone feels the same in whatever state we are in.
I think that's such important information that you bring to us here today. One of the purposes of this select subcommittee is to gather information, to be proactive, to have that understanding when moving forward, and unfortunately we might face another pandemic, what appropriate steps need to be taken. Your information and the other panelists being present today allow us to formulate those opinions. I thank each and every one of you for participating here today. I thank you, Mr. Chairman, and I yield the remainder of my time.